when are you hiring the accountant for your practice right away when you start up, or like are you doing it, or how is it going on? Any of you guys start.
So for me, okay. So my uncle is my CPA, so he formed the LLC for me. He did like everything. Like even like my payroll and stuff. I just send him at the end of every 2 weeks. I'll send him the number of hours worked. Like I have one staff member on per hour, and the other is salary. So at the end of 2 weeks, I'll just send them that my assistant's number of hours worked, and they'll send me a paycheck, and then I'll just print it and give it to my staff member. So I mean, you need a CPA, I think, from day one, or even before that. Even before you open the door, you need somebody to help you do all those things. And then obviously making sure you pay your staff members on time. That's the other biggest thing that needs to be done. Is like you got to make sure they get their paychecks a day or two before like the Friday. So I usually give it out on like a Tuesday or Wednesday on the Friday that it's due on. So and then as far as like accounting and stuff, so again, my uncle's doing everything for me, so I really don't have. I just give him access to all the data that he needs, and
that's very good to have family help,
just do
right?
whatever he needs to. It is.
But then, what about the accounting for the patients and stuff? Like, how much is going in for how much are you presenting to the insurance? How much are you getting back? And who keeps a check of that? Like, who keeps the tabs on that? Like, how much are you getting paid? Like, where's the money coming from?
Claims. Yeah, claims, insurance.
Claims, that's your front desk's job. So usually, the software that I use, dentistry send, automatically every 2 weeks after a claim is sent, and if the payment hasn't been received, it'll show a pop-up on the main screen. When you log into dentistry send, it'll show you that you need to follow up with these claims. So then my front desk will go in and either call up the insurance company or check on the website to see what the status is of those claims, or if it's been denied, if it's rejected, whatever it is, and then follow up with me. So usually, most softwares have that where 2 weeks, or you can set the amount of days you want it to. Like in my case, it's 2 weeks, where if it's not paid by 2 weeks, then you have to follow up with the insurance company.
Makes sense. What about you, Kishwi? Like, do you use Dentrix, or what do you use?
Yeah, so I use Open Dental.
So I think a lot of these startups use Open Dental because I think it's the less expensive one.
It is the least expensive one, and it also has some features that, for the accounting purposes, it's like a little bit easier. So my husband is who's not a dentist but has like a lot of experience dealing with businesses, saw how heavy like the dental office is kind of dependent on employees. So one thing that we've done kind of consciously over the last 3 years is try to sort of have a very seamless experience for our patients. And then also, like, whenever you have a lot of employee dependent work, if there's employee turnover, then all these things get lost through the cracks. So like a lot of these things are like, ask me how I know. I used to have one person who used to do the claims, and when she left, it was just like we were in a AR debacle. Like there was like such a big backlog, and nobody had followed up with the insurance. I didn't know how to do it. So that's one thing I learned, how to kind of like verify insurance, present treatment, send a claim, and then once the claim comes back, how to post it to the patient's account and then calculate what their balance is. So number one, I know how to do all of this, but now we have outsourced it to a company called Dental Claim Support that sends the claims, receives, when you get the claim back, they'll post it to the patient's account, and then they will notify if the patient has a balance. It's also nice because they write the narratives for me, in most cases, if there's adequate documentation and based on my clinical notes. So I waste very little time. And what I liked about this company is that they get paid when we get paid. So there's no monthly flat fee. It's a percentage of the collections from insurance AR. So they will also follow up, if a patient's insurance hasn't paid for over, it's usually 30, 60, 90 days is the AR cycle. So if they haven't paid in 30 or 60 or 90 days, they'll follow up, they'll see why. And then if there's like, if they have a reason, then like we'll send in more stuff. But usually they contact me like after they've already tried everything on their part and send a narrative or two. So I like that it's, yes, they cost as much as like a front desk person costs, but like, guess what? If my dental insurance claim account executive is lost, then it's dental insurance's problem to assign me a new account executive who knows what to do versus like me that I have to follow up.
Yeah.
We also do like payment plans for patient portions. So the 1st and the 15th of every month, I've assigned that to somebody up front to make sure that the patients have paid their portion, and we collect prepayments and then at time of service from patients themselves. So my 30, 60, 90-day AR insurance AR is within industry acceptable standards, but I do a lot of, again, ortho with the Invisalign, so I have a lot of payment plans, and even those are okay for us. Not every office can afford to finance patients for about a year. We're fortunate that we can, so we do.
Good. Yeah, talking about payment plans, like I've heard a lot of dental clinics also have these plans where they treat patients without insurances with payment plans. Is that similar to what you are talking about, or is it like related to ortho, where when I got my ortho treatment, I would pay like 300 per month until it was like 5K for 2 years or so, right?
Yeah, so it's a little bit of both. If there's like somebody needing a crown or something, and so we can offer to split up the payment in 2 or 3 cycles, like bigger treatment, as I do more like invasive implant and cosmetic stuff. Sometimes these are like $10,000, $15,000, $20,000 treatments. And then sometimes like we'll work that out. But it's, so we have like sort of like an unwritten rule that anything over 2,000, my front desk, my treatment coordinator can do in-office financing. So we charge like an 8% management fee because somebody has to like run their credit card. It's automated, but somebody has to check if the payment plans went through or like the credit card was run. So you're sort of, so there's very like 2 schools of thought on this, right? So some dentists and some consultants will say you went to school and you got a dental degree, you didn't go to finance school and get a businessman.
But we have to,
so like you shouldn't be a bank. So some dentists say, well, I'm not a bank. Like, when you go to HEB or like when you go to like a grocery store, you pay for your goods and you don't like, they never ask you for a payment plan or something. My personal philosophy is I look at all the banks and the banks are rich. So even if you have eventually like your systems have to be good to collect from these patients, but I'd rather take kind of what you said for an ortho treatment. I'd rather take $5,000 over 2 years than take $0 right now. Right.
I mean, the orthodontist that I went to, their office just does it that way for everyone. So I was like, oh, okay, well, okay. That was easy.
Yeah, I mean, I do encourage patients to pay in full whenever they can. We have a pay in full percentage off, but again, like I feel like, and this is more philosophical, but I feel like we always pretend like dentistry is affordable, but it's really not. For the average American, $1,000 for like one crown and like a couple of fillings, it's a lot of money. Even like you and I, if like we had to spend $5,000 at
straight up
Invisalign, like I would think about it for a little bit.
Straight up out of your pocket, like it's a big amount. So more than monthly whatever rent or mortgages for a lot of people. So it's not easy for everyone to just give you the check right out.
Right. Yeah. See, the flip side to this is that you don't want to be the bank, because what if the patient cancels the credit card and then they haven't paid their portion?
So then,
I always prefer third-party financing. The third-party financing is what I prefer. Care credit, lending clubs, or something of the other sort, where I know I'm going to pay 7, 8, 9, 10% upfront as financing fees, but I know that I'll get the remaining 90% right off the bat, and then whatever the balance is, that's between care credit and the patient and not the patient.
There must be a fail-safe mechanism for this as well. I guess, again, the demographics might help. Certain demographics might be in a place where the patient population might be with a better credit score, and then this might work. And in certain population where the credit scores aren't high, you might need to rely more on care credit, probably. Right?
Well, if your credit scores are good, you're not going to get a proof of care credit. So it's but again, that's what my point is. Like, a lot of times these patients can be like, oh yeah, we'll pay you over these many years,
and they just stop their card.
If their credit is not good enough, that's a red flag right away, right? That's a red flag to me that, like, if they haven't paid properly in the past, how do I expect them to pay on time in the future? So
makes sense.
So, but that's my way of looking at it. I mean, I prefer not to do in-office financing just because I feel like there's way too much risk, and then what if the patient, and obviously if we're doing ortho cases, I would collect at least 40% up front to cover the lab bills, because ortho cases have like a huge lab bill involved, so that would, at least the first payment from the patient would would be enough to cover the
Yeah,
liability.
I like, I mean, you have to hedge your bets a little bit. So kind of what Rohan said, like collect a down payment, make sure that like if you have lab fees involved, like those are sort of accounted for and paid for. But here's the paradox, right? Like and that's true for every, I think, city in America, is like if the patients have typically good credit score, if they have good income, they have better teeth. And the patients who need dental work typically have lower, like they're lower socioeconomic kind of strata of society, and they may or may not have the best credit, and they need the work the most. So like I was very thoughtful in where I opened the practice. So my patients, I think like the annual income, family income is like at the time it was like 70 to 80,000. Now, of course, post-COVID inflation world is a little different, but that was a sweet spot for me because they needed a lot of dental work and they had a lot of dental needs. And yeah, occasionally they don't qualify for care credit, but and again, if they have insurance, then it helps because insurance is going to pay a portion. Maybe they'll pay like a down payment, and then the other two payments can be like split in two and then collected. And then we have a credit card authorization form where we take 2 credit cards or a debit card and a credit card, Social Security. So there are checks and balances, but it's also coming down to cash.
Yeah, locked out or something happens. Yeah.
And then, And then ortho is very easy. I mean, if they're defaulting on their payments, then their treatment's not going to continue for very much longer. So, and but I will say it's a cash flow thing, right? Like if you're struggling as a practice with cash flow, then you can't afford to finance patients' treatment. But if that's not an issue, then you can be a little bit more aggressive in office treatment.
So at what point?
So it's just like so many different factors.
Would you recommend starting with payment plans? Like, when should one start it? Like a straight up cash flow is going to be hard, right? First few months of the practice. So,
well, I mean, you have a working capital, and everybody should account for that in their financial projections for the practice. So if you have about 3 to 4 months liquid cash as your working capital, you don't technically and then if you're in the red every month, meaning your expenses are more than what you've collected or what you have in the bank, then obviously that's a big red flag. So it just kind of depends on what the comfort level is, and at what point are you if your practice is profitable or your net collections are positive, then, or what you have in the bank every month, what you're collecting is more than what you're sending out, then again you're net positive on cash flow. I mean, there's several different things, but to make it very easy, if your expenses are more than what you can afford, you can't afford patient financing. And then it's important the first 3 months, right? Because insurances usually take 30, 60, or 90 days to pay you. So the first 3 months, it's tough because everything is going out, so little is coming back in. But, after a year or two, it gets easier.
Good to know. We had to talk a little bit about inventory. How do you guys manage that? Who wants to take it?
I mean, it's easier for me. It's really, because I mean, I don't have a super busy office or 14 people in the office. So for me, it's really easy. Obviously, we have one box. Say, anytime somebody opens up the second to the last box, we always put it down and put it in the cart or write it somewhere where where we know that, hey, this has to be on the next order. So it's a little bit easier because we don't go through that much stuff really quickly. So and then my front desk does most of the ordering for me. So it's in a really high functioning office. I think Keshu can tell you better how do they do their inventory and stuff. So
yeah, so it's similar. We check what we have, what we're running out of. My orders are placed twice a month. So every other week, and then typically the industry standard is 3 to 5% for inventory stuff, and then I divide it between front office and back office. And then for us, for me, I do implants, right? So implants is separate. Endo is a little bit more expensive. So I try to keep an eye, and then I tell my lead assistant every month, hey, it's 3 to 5% of your previous month's collections is what ideally your inventory budget should be. So we are kind of we try to stick to that budget as much as possible. Of course, if I suddenly needed bone graft and implants, that's going to be a couple $1,000s. So I don't count that as much. So I tell her to stay within 3% because the endo and the implant, bone graft, biologics, they get ordered separately, and I keep somewhat of an eye on that. But yeah, it's you just have to, I think in the early days, I used to like actually finding good deals and ordering them and stuff like that when I was sort of Rohan size, and I'd like look at where you get the best stuff. And that's largely remained true. Every year I look at the invoices and I see the price increase. A lot of the supply companies put us on 5% annual price increase. So like I'll go back and say, okay, why is this price suddenly more? It's the same product. So my rep is aware that I keep an eye, and then every end of the year I renegotiate some prices. So they know me as a total ball buster, but you know, they're making...
if you're
pretty
ordering
good money
a
from
good
my
sum
office
from
on
them,
commission.
then obviously it's a good idea to negotiate, because I have seen some of the price ranges that the corporate companies get, and it's like half of what we pay as general dentists. You know, it's like there's a lot of difference.
I'm still overpaying. Yeah, I'm still overpaying by like 10-20%, but at this point in my life, my time is a little bit more valuable than a couple $100 I'll save. But in the beginning, like, I think for a very long time, for about a year and a half, like, I used to do all the ordering myself, and I used to keep like a hawk eye on it. And then finally I said, okay, well, you know, if I spent like extra 30 minutes like talking to a patient about some treatment, that is more worth of my time than doing this. And I have enough people now.
Right.
I have enough assistants to do that for me.
So you have right now? 6 assistants, and
I have
then
6 assistants.
2 doctors, with like one you, and then the other one is the associate.
Yeah,
Cool.
and then I have 2 hygienists.
That must have been a busy office, right?
I have some white hair that I never used to have before.
But yeah, we're all learning from her, so it's wonderful to know from you, Keshri. I hope you continue growing, and Rohan, you too. And I am learning from you guys.
But I do have to say it's impressive, Sam. You do a lot of things that I didn't know as an associate. You already know, so I feel like impressive.
Keep an eye on these things, and eventually, that's the goal. Right? So far, I'm still
that's great.
So that's been okay.
Well, I think
associate,
my
it's easy.
associate. Yeah, I was gonna say I think my associate has a great life. He doesn't have to worry about anything. But no, it's still impressive, and you know, the more you learn earlier, the lesser like hiccups you'll have later. And I have made like all the mistakes I could possibly have made. I have like gone to the bathroom of my office and cried, and I've had like during COVID, I had like full team turnover and some employees not show up. So like I've had, you know, sort of like really, really tough times. So it's very easy for me to now sit and say, oh, this is easy and this is how we do it. But as you kind of look back and reflect, you know, it's I've got thicker skin. Yeah, so it's not a stress that is, you know. But I often say to like younger dentists that I've mentored, pressure makes diamonds. So eventually, you know, you're going to learn and you're going to get better.
And is there anything else that you guys would like to add in our lecture today?
I like how you say lecture. Rohan, any words of wisdom? What would you do differently now than like 8 months ago, or 8 months down? What would you do differently, or is there anything you would do differently?
I mean, so I mean, maybe open up in a more rural area. I would say, like, you know, where there's not too many dentists around, and as Keshi was saying, like a lot of the patients that I see are pretty well off. Like, I think the average income in my neighborhood in the 1 mile or 3 mile radius is over $120,000 is the average household income. So I usually don't have, if they need any treatment, I usually don't have a lot of difficulty in getting treatment acceptance. But the thing is, like, most of the time they don't need a lot of treatment either. So they usually have good hygiene, they have good health. So it works in both ways. Like, you know, it's good that they don't need a lot of work, and if they do, they usually end up getting it done within a week of, like, you know, saying, hey, you know, you need this done, and within a week it's already completed. So it's a good and bad thing to have. But you know, I would say open up in a more rural area where there's, like, you know, not too many dentists around. I think that would be
probably in your situation, like a cosmetic focus would be more effective. In your area, probably.
Right. Yeah, I mean, especially, like, I think, like, a lot of people, like, that I see, they ask for, like, all these sedation and all these other things. So now I'm working on getting IV sedation certified and all that stuff. So it's just the, like, you know, you need to have like a separate set of skills that are trained.
I have a dentist, an older dentist. He only does IV sedations now. He used to come and only do that. So, you know, you don't have to worry about paying attention to all the alarms and details of all of those things, and you're just like working, and within like 2.5 hours of the sedation, you're done with the treatment, and go ahead with that. But that's obviously going to be out of pocket. But that dentist would straight up talk to the patient themselves, and he was the sedation person we would go to. Or we still do like oral sedation in the clinic, which is as effective. I mean, unless a patient needs a higher dosage of sedation when you go for IV. So try either of those, whichever works for you might well.
Right.
Yeah. I think like I'll end with, I will put this one thought out there, and then I don't know if this should probably be like before one even thinks of like practice ownership in whichever form, like whether it's startup or acquisition, is the vision, right? Because oftentimes like people think like, oh, I've been a dentist for X amount of years, the next natural and obvious progression is to own a dental practice. I think that's, in my opinion, that's not what you should look out to be, because there's like a lot of dentists who, you know, let's say as an associate you're making 150, 200, 250, 300 even, and if you're definitely 200 plus, in my opinion, if you're 200 plus, then you don't want to put yourself in a situation where you are starting up a practice or bought a practice where you're also going to only take home 200 or 250. It's better off being an associate and taking home that money, because with a startup or whenever there's practice ownership, there's just so much more sort of responsibility. There's so much more stresses. There's so many more sleepless nights, and there's such a big financial burden that I often tell dentists, like, you don't want to buy yourself a job, because if you buy, like, let's say an acquisition for 600-700K and the owner dentist was taking home like 100, 150, and even if you double the production and you're taking home 200, 250, you've just bought yourself an associateship job with all of the stresses and all of the financial commitments. So I think the vision is really important. Or if you really enjoy this, or if you're like really entrepreneur minded and saying that like, oh, I want to have a business of my own for other reasons, I think it's worth it. Just a simple increase in like salary is, I think, not worth it. Because I've also seen during COVID, I've seen about 7 to 8 colleagues and actually 2 personal friends sell their startups and sell their, like, they've owned their practices 3 to 5 years and they've sold it. And now they're working associateship jobs and making way more with less tension and less stress and less headaches. And then honestly, some people aren't meant to be leaders. They're better dentists than they are, you know, bosses and business people. So I think asking yourself that question ahead of time, like, what's the plan? Like, what's the vision? Is this right for me? I think that's really important. And I didn't know any of that. And my associateship job, I was like probably if somebody looks at me now, they say, oh, you, like, I don't know that you could ever have that X, Y, and Z, because I was like very laid back as an associate. Yeah. So, but that's what happened. Like, and you know, there are, like, everybody says dentistry is recession proof and stuff, but that's not true, because on the flip side, again, I see like all these practices come up for sale where the owners haven't owned their practices for very long and they're not worth anything, because I can start a practice for way cheaper instead of buying a practice for $600,000 where the owner is taking home $100,000. There's like no upside to that. So, I think it's, ignorance is bliss in a way, because you don't know how stressful it's going to be. So you do it anyway. But I think like, I have 2 friends like declaring bankruptcy because they could not make the monthly payment for their office. So that is also a very tough situation to be. So, you almost kind of have to be like, have nerves of steel, or like no hair.
I'm
like,
getting white hair too.
Like
that's
me.
like colored a little bit.
I didn't do this. So yeah, or, you know, if you're very happy with your associateship job, and I'm not talking about you, Sam, but just people out there who are making really good money, I would say keep at it, because in the next 5 years, about 60% of practices are going to be corporate owned and corporate joined. And this is not something that like worries me, but all the private dentists have to just work a little bit extra harder to make sure that the quality of their practices are better, so that you also stand out. So I think vision and like, what is your why and what's the purpose? I think those are very important things, because in times where, like, I mean, I think of selling the practice like 4 times a week, even though like from the outside we're doing really well, and I'm just like, I just won't have to deal with this. Like, it would be nice if I could sell this and like just stay at home and not do anything, you know. And I joke about it, but like it's very stressful.
You know, just to
even
tell
now.
you about this, about last week, I saw a practice on Middletown. It was 100,000. It was already set up. He was selling the practice. He set it up in 2020, and he was selling it right now. And I was like, yeah.
Basically for free. Yeah.
The cost of the equipment must have been more than that. Like, I was shocked at that price range. I was like, what's going on?
Yeah, I think business is not for everybody. I think it's because this is apart from clinical, this is more like a business side as well to it. So it's like how well you market yourself, how well you, how many patient referrals you get, like internal patient referrals, and it's just like word of mouth. Like how, you know, a lot of those things go into play, like customer service. Like, are you personable? Are you not personable? Like, you know, you can't delegate everything to the staff. Sometimes you gotta, like especially with a new startup, you have to be the face of the practice. Your staff cannot be the face of the practice, so you're the one who's supposed to do pretty much you're supposed to know everything. You're supposed to talk to the patient nicely. So I think it's just like it's a lot of hard work in the beginning. I think,
and I'm sure it's going towards the right. Yeah.
It's not all doom and gloom though. I think probably I keep saying I want to end, but like I want to end with like the positive of it, right? Like, so I think for me, practice ownership has accelerated my clinical dentistry way further than if I was an associate. So like I get to do whatever I want. There's no oversight. Like I never thought I would do Invisalign, but like I'm a diamond Invisalign provider. You know, I'm doing all these cosmetic cases that I never thought I'd do. I'm placing all the implants, and I'm doing like full arches that I never thought I'd do. I never thought I'd just work, like essentially make as much as I do on a 3-day schedule. I never thought I'd like give employment to like 14 people and like develop lifelong, even some of the employees who are not with me anymore, like they still reach out. So like develop lifelong connections. And then sort of like, I know you're running the channel for like international dentists in a way. So like my associate is an international dentist, and I did sponsor his H1, me being like, because I had been in that position myself. So I think personally, it's like the most like gratifying thing I could ever have done. So it's not all doom and gloom. And then, you know, financially too, right? Like practice ownership is the surefire way of getting out of student debt too, because like the amount you can make as a practice owner, you could pay off all of your debt. Sooner. Going to NYU, you could pay it off in like a couple of years. So, so there's many positives to it. It's not a deterrent at all. But I think you just kind of have to be open. As Rohan said, you're wearing many hats. So you just have to be open to the challenge and work really hard, and not just in dentistry work hard, but work hard with everything. But you know, it's rewarding. Like I often say, I get paid for two things. I get paid for clinical dentistry, and I get paid for being an owner, but I am doing owner level work and owner level stress. So I should be paid for it. And that's the thing, is like, if you're buying a practice, better well make sure that you draw salaries in two ways, not just like 100, 200K. And I don't think that's worth it. Or initially it is, of course, but eventually that the long-term goal is.
I think that there's a lot of tax benefits that you get too. I feel like
you can write
once you get into practice ownership, you'll realize the amount of tax benefits that you can get.
You can technically get some of it as 1099 too, if you're an independent contractor. But we'll try not to.
And the second thing I would say is get a second job as well. I work, I keep my clinic closed on Wednesdays, but then I go and work. Yes, I go and work for a bunch of other people on Wednesdays, and even Friday evenings that I'm free, I usually go and work somewhere else. So just to help pay the expenses of the office and all that stuff too. So even though I'm not, even though we're not in the red, but I still want to get a good enough cash flow. So just to
it's a personal. I mean that I think is like a very personal choice, because I didn't work. I work full time, but I was lucky to not have a lot of my expenses were already taken care of. So that kind of goes to your personal financial situation.
Right. Yeah. Because I mean, like if you're the only. I'm not the only the breadwinner in my family, so it's good to have that. But then I always want just to have that extra additional money. It's just additional. I mean, so
considering you guys don't have kids yet, it's a better situation right now. Whereas to me, at least I am married to a person who's not a dentist, so I'm still not like we have two bread. So it's a better situation versus two people who are under a huge student debt from their own school. And you know that can be kind of a different situation. Yeah. All right. Well, so it was so nice chatting with both of you. I got a lot of information for all of our viewers. Thank you so much, Keshri and Rohan, and I wish you all the best for all of your future endeavors. And I hope your practices reach the highest level of success that you could possibly aim for.
Thank you. Thank you. The least level of stress. Please also hope the least level of stress.
You have on your staff for a long
the highest success. But we'll see. We'll see what happens tomorrow. Monday morning, I'm ready. I'm ready for some of the comments.